Hey, welcome back to your Caribou Data Science channel, Buckeye Nation. Today is Sunday, August the 15th, 2021. That means because it is Sunday, that's right, it's two for Sunday. Today, you get two reports for the price of one. In addition to your daily COVID-19 analysis, you also, at no additional charge, get a weekly COVID-19 vaccine report for the great state of Ohio. So let's begin with the vaccine report. And we can come over here, you can see that currently Ohio's administered 22 million doses. They have, so about 5.96 million people have received uh, the first dose, and about, what, 5.05 million have received the full dosage, okay? That's a short but sweet report. Let's come over and take a look at the daily report now. Okay, so what you can see here is this is a not so subtle reminder. We need to keep in mind that according to the governor's office, COVID-19 deaths for the fourth quarter of 2020 were undercounted by close to 4,000. Okay. Uh, but in the governor's office, infinite wisdom, what he did was what the governor's office did, he came back and he added those numbers on to February 11th, 12th, and 13th. So what I did, I removed these numbers and replaced them with the average number of deaths for these 3 days. And this is a little better. I mean, these could be a little higher, a little low. It's hard to say, but still pretty close. So now we come, and this is the raw COVID-19 deaths. This is where we're missing the 4,000. This over here could very easily be okay, but then 4,000 were added on. A few summary statistics. This is the red line is the 7-day moving average on top of daily deaths. You can see since December the 1st, the deaths have been declining. You notice also a very distinct stair-stepping effect. Which also you find kind of curious. How can this pattern be consistent when reporting numbers on every single day? What about cases? Well, this is the raw cases. Again, you got these crazy negative numbers here and these big spikes here. So let's take a look here now. Now this is again, you need to keep in mind about vaccines is this. COVID-19 vaccines are designed to reduce the chances that you'll die from COVID-19. It is not designed to prevent you from getting COVID-19. If that's correct, that means this number can continue to go up and this number could continue to go down or go up at a much lower rate. Because you can see this nice declining pattern in deaths here, okay, cases, followed by about mid-July, this they began to climb up pretty swiftly. So what's the good news? The good news is don't overreact reports of cases and hospital beds. According to Washington University here in the U.S., the single best measure of a pandemic is daily deaths. And that's what I want you to focus on. Don't be misled by all the media hype talking about hospital beds and cases. Because anybody can get admitted to a hospital bed. Of those people who are admitted, how many tested positive for COVID-19? Okay. We only know the number of people who died. The best number we have, most accurate, is deaths, because we know when someone died from COVID-19. All right. So anyway, don't overreact. By all means, continue to get the vaccine. But you know what? As long as there's people who don't get the vaccine, the cases and deaths can decline. Okay, it can increase. That's the problem. It's not a problem for me because it should be a problem for the friends and family of these people who have to bury the soul when his arrogance or his or her arrogance kept them from getting the vaccination. But that's a whole different subject. So now let's come over here. For some reason, this didn't run. Sometimes, for whatever reason, sometimes it doesn't actually create the index file. Okay, Buckeye Nation, this does conclude the report for today. Don't forget to click on that subscribe button, the share button. Click on that share button, share this video on Facebook and Twitter. You can also copy and paste the link to this video into an email or text message and share it with your friends and family that way. Thanks so much, Buckeye Nation. We'll catch you tomorrow with an updated report.